Today we'll be speaking to Sylvain, who's doing his doctorate of pharmacy at Laval. And so, Sylvain, to start off, could you tell us more about your coursework, what you've been studying in your first 3 years?
Yeah, for sure. So I'm a third-year pharmacy student at Laval University in Quebec City. It's a very small French university in a relatively small town, so it's quite like a quiet vibe there. So it's ideal if you want to pursue serious studies as a student, and if you want to enjoy for life like a mixture of American and European lifestyle. It's a good point there.
Right. So what coursework have you been doing in your doctorate of pharmacy, and what advice would you give to students to see whether they're actually interested in the field?
It's highly clinical, so like there's a lot of for sure drugs to memorize, but also it reminds you that you're not only dealing with medication but also with patients, because you're a healthcare professional, right?
Yeah.
So it teaches you a lot about professional judgment, about empathy, and how to really take care of patients and put the patient not only as someone to be treated but also as a partner. So you take decisions with the patient, you follow the patient, and you stay aware of their needs. So I think that's also the advice I'll give to pharmacy students or people who want to study pharmacy, is really to be aware of the why. Do you want to make people's life better, or do you want to make money? Let's say, do you want to contribute to the advancement of medicine, or do you want to go for the fame? Because if you go for the fame, for the money, soon you'll get tired. Whereas if you have in mind the desire of serving, then it's a driving force that pushes you forward.
Yeah. Speaking about opportunities with your degree, are you looking to what are the career opportunities in the field of pharmacy today?
Well, I'm very lucky because in my program it's 100% secure that you're going to get a job at the end, because pharmacists in Quebec are very highly in demand, and we have a very high pharmacy depletion. So most of my colleagues are gonna go into community pharmacies to work as pharmacists. Otherwise, you can also do 1 extra year of sophisticated advanced pharmacology, and that'll allow you to work in hospitals. Or otherwise, you can also work in pharmaceutical companies such as Pfizer, Johnson & Johnson, Moderna, as I think it's called drug developers. So many opportunities.
Yeah, I think even with so many innovative ideas coming in for medicine and pills for diabetes and other diseases, I think it's a very vast and growing field. It's very needed as well.
Yeah, for sure.
Yeah. So, what's your experience been studying at Quebec City?
Well, Quebec City is a bit like a bubble. I come from Montreal. It's a much more vibrant city that I like very much. Quebec City is way calmer, so I think it's more suitable for the city life. For sure, sometimes when things get hard, and it's gonna get hard. I'm gonna miss Montreal because my friends are there, my family's there. But it has been quite an experience of personal growth, because you have to know how to live on your own, and you also get to meet new people. Most of my friends aren't from Quebec City because it's a very small town. Most of us are from the outside, from Montreal, from elsewhere in the province, and we really learn to bond with each other. So that's what I really like about living in Quebec City and going to Laval.
Yeah. One final question I had was about applying for the degree or program.
Yeah.
So what tips would you give to a student looking to work in the field of pharmacology or pharmacy? What are the steps on submitting an application for the doctorate of pharmacy, and what skills do you think a person really needs to be successful in the field, in your opinion?
Well, I think for sure the first thing to keep in mind is that pharmacy is a very it's a very demanding program. So be ready to work a lot. Be ready to sacrifice a part of your life for the program. The acceptance rate is still kind of low, because I remember when I applied, we were selected. We had like 200 students accepted among maybe 2,000 applications. So like be ready to work very hard to get there.
Yeah.
And yeah, just get to love to work, get to love to, you know, give it your heart and soul, basically, and keep in mind that the hard work is going to be worthwhile at the end.
Right.
Yeah.
And one final question I also had was,
Yeah.
what got you interested in like pharmacology? Was it like medicine or helping people? Like you spoke about how your occupation is going to be mainly based on having a relationship with the patient. So
Yeah.
what got you interested personally and into the field?
I think a main driving force will be my faith. I'm a Catholic, and for me, I find it more interesting to put others first, and then myself second. Not saying that I don't care about myself, but like I find it far more interesting to get to know other people and to know their needs, how I can like make their lives slightly better. And then at some point when I was in high school, I talked with a lot of doctors, nurses, and that got me interested into health. And I was wondering, how can I make my passion for biology, chemistry, and my desire to make scientific discoveries match with my future career, and that's what got me into pharmacy.
Okay. Thank you so much for your time. Really appreciate it.
Thank you. Is that good?
Yeah, that's good.
In the